Audrey had changed her glasses prescription twice in 18 months. She still could not read the menu at her usual restaurant. If that sounds familiar, if your vision keeps getting worse after 70, despite new glasses, despite eye drops, the problem is not in your eyes. Think about the last time you sat down to read something and had to hold it further away. Or the last time you were driving at night and the headlights started to blur. You told yourself it was just age. Maybe your eye doctor gave you a new prescription and sent you home. But here you are, months later, and things are not better. Here is what nobody connected for you. Your eyes do not operate alone. They are fed by the same blood vessels that your blood pressure is damaging right now. They are clouded by the same sugar that your blood sugar logs are tracking every morning, and they are affected by medications you take for completely unrelated conditions. Possibly. There are 5 specific reasons vision keeps declining in people over 70 who are already doing what their doctor told them to do. 5 reasons, and almost none of them get explained at a routine eye appointment. 4 of them have to do with what is already happening inside your body. Things you can bring under better control starting this week. One of them, the one I'm going to save for last, has nothing to do with what you eat or what drops you use. It is a medication many men over 70 are already taking, and it can turn a routine cataract surgery into a serious complication. Most urologists never mention it. The people who never hear this keep changing their glasses prescription and wondering why nothing improves. The ones who do hear it bring 5 specific questions to their next appointment, and the answers change what happens to their vision. Have you or someone you love noticed changes in your vision after a blood sugar or blood pressure diagnosis? Tell me in the comments. I'm Dr. Sarah Kim, emergency medicine physician, 15 years in preventive care. Let me show you what I found. Let me show you exactly how this works. Starting with what is happening inside your eye right now. Your eye is like a camera with a very delicate lens and a very delicate film at the back. Think of the retina, the light-sensing layer at the back of your eye, as that film. For the film to work, it needs a steady supply of clean, clear blood vessels delivering oxygen to it. Now imagine those blood vessels are made of garden hose material. High blood pressure squeezes the hose from the outside. High blood sugar makes the hose material brittle and leaky. Both things happen at the same time in most people over 70 who are managing both conditions. The result is that the film at the back of the eye starts to fail. Not because the eye is broken, but because its supply line is damaged. That is the core connection. And each of the 5 ways it plays out has a different fix, starting with the one most people never hear about. Before I get into the 5 reasons, I want to tell you something that most vision videos never say. The best thing you can do for your eyes right now may not be an eye drop or a supplement. It may be the number your blood pressure cuff shows this morning. A study published in Ophthalmic Epidemiology in 2016 tracked 172 adults with early macular degeneration, damage to the central part of the retina, over 4.5 years. Shim and colleagues found that high blood pressure made macular degeneration more than 10 times more likely to get worse. That is a stronger effect than any supplement on the market. What this means for you: if you are taking an eye supplement and your blood pressure is still running high, you may be addressing the smaller problem and ignoring the bigger one. Reason 1. Blood sugar damage to the retina is more common than most patients know. Think of your retinal blood vessels as tiny straws. Years of high blood sugar coat the inside, like buildup in an old pipe, until the flow slows. A Swedish study of over 141,000 adults with type 2 diabetes, average age 83, published in Acta Ophthalmologica, found roughly 1 in 3 already had some degree of retinal damage. If you have diabetes and have never had a retinal exam, you may have damage that has not been caught yet. A 2021 UK study, over 11,000 patients followed for 7 years, published in Diabetes Research and Clinical Practice, found each small rise in blood sugar at diagnosis added a 5% increase in retinal damage risk. Every point your blood sugar comes down matters. Reason 2. Your dry eye may not be dry eye. Most people with dry eye are told to use lubricating drops. That works for standard dry eye. But in people with diabetes, high blood sugar damages the nerves that tell your tear glands to produce tears, so they slow down. Drops wet the surface, they do not fix the nerve. A 2022 review in Frontiers in Endocrinology confirmed diabetic dry eye is caused by nerve damage, which is a different problem from regular dry eye and needs a different treatment. If you have both, ask your doctor whether your blood sugar control is part of the treatment plan. Reason 3. Night driving difficulty is not just aging, it is an early warning sign. Trouble driving at night is sometimes attributed to normal aging, but it is also the earliest known sign of macular degeneration, appearing up to 3 years before damage shows on a retinal scan. The cells your eyes use in low light, called rod cells, are the first to go. A 2024 study from the University of Alabama at Birmingham, published in Investigative Ophthalmology and Visual Science, confirmed rod cell slowing is detectable before any visible damage appears. A 2020 paper in BMC Ophthalmology found a 5-minute dark adaptation test, usually covered, no dilation required, correctly identifies rod cell slowing in more than 9 out of 10 people tested. If you have trouble with night driving, ask your eye doctor for a dark adaptation test by name. Reason 4. Your AREDS supplement may be the wrong version. The original AREDS formula contained beta-carotene. A large 5-year trial published in JAMA found it nearly doubled lung cancer risk in former smokers. The updated AREDS 2 formula replaces beta-carotene with lutein and zeaxanthin. A 10-year follow-up in JAMA Ophthalmology confirmed the updated formula works better. With no lung cancer signal, check your eye supplement label. If it says beta-carotene and you have ever smoked, ask your doctor about switching to AREDS2. Now, before your next appointment, here are 5 specific questions to bring. Each one maps to a reason. On blood sugar and your eyes, ask your doctor this exact question. Is my HbA1c, my average blood sugar over 3 months, affecting my retinal health right now? Then ask, what number are we aiming for, given my age? Note: for older adults with long-term diabetes, avoiding low blood sugar episodes matters as much as bringing the number down. That balance is a conversation to have with your doctor, not a number to chase on your own. On blood pressure and macular degeneration, ask this: is my blood pressure controlled well enough to protect my retina? The evidence shows that blood pressure may matter more for macular degeneration than any supplement. Your target is a specific conversation, not a generic, keep it low. On night driving, ask your eye doctor, can I have a dark adaptation test? It takes 5 minutes. It does not require dilation. It is usually covered. If your eye office does not have the equipment, ask for a referral to one that does. On your AREDS supplement, check the label before your appointment. Write down which version you are on. Ask, am I on AREDS or AREDS 2? And which one is right for me, given my history? On dry eye and diabetes, if you have both, ask your primary care doctor, is my dry eye connected to my diabetes? Then ask your eye doctor, are there treatments for diabetic dry eye specifically, or am I being treated the same as someone without diabetes? Reason 5. The medication warning most men over 70 have never received. Tamsulosin, taken by many men over 70 for prostate symptoms, relaxes the muscles in the body, including a small muscle inside the iris of your eye. During cataract surgery, this can make the iris go floppy and turn a routine procedure into a serious complication, even if the medication was stopped months earlier. A 2022 review by Saad and Maish in the Senior Care Pharmacist confirmed this risk in older adults specifically. If you or a man you know takes tamsulosin or any alpha blocker and cataract surgery has been mentioned, the surgeon must be told before the consultation, not on the day of surgery. Before I close, Let me tell you what happened to Audrey. Audrey had changed her glasses prescription twice in 18 months. She still could not read the menu at her usual restaurant. At her last eye appointment, no one had asked about her blood pressure or her blood sugar. She left with a new prescription and no other answers. 6 weeks after connecting the right specialists, things were different. Her eye doctor had reviewed her blood sugar log for the first time. Her supplement had been switched from the original AREDS formula to AREDS 2, and her tamsulosin had been flagged to her cataract surgeon before the consultation. Her night driving had not improved. Rod cell damage at that stage does not reverse. She knew that now, and she was not waiting for a miracle. But she had a dark adaptation test scheduled. She had a clear picture of which condition was driving which part of her decline. She had a specific next action for each one. Not everything could be fixed, but nothing was unexplained anymore. That is a different place to be standing, and that matters more than most people realize. The risks I described can be avoided, but only if the surgeon knows before the procedure, not after. The floppy iris complication from tamsulosin is now well documented, which means any ophthalmologist performing cataract surgery in 2024 has tools to manage this risk when they know about it in advance. The blood sugar and blood pressure contributors to retinal damage are also addressable. The earlier they are identified, the more visual function can be preserved. Audrey's doctor could not reverse what had already happened, but what came next was manageable. That is what early identification gives you. Have you noticed changes in your vision after a blood sugar or blood pressure diagnosis? Maybe the changes came on slowly, and you told yourself it was age. Maybe you mentioned it to one doctor, and it never got connected to what another doctor was tracking. Tell me in the comments. Tell me what you noticed and whether anyone ever explained the connection to you. I read every comment on this channel, and what you share helps other people watching this video know they are not alone. You now know that your vision is not a separate system. It is a window into how your blood sugar, blood pressure, and medications are working together. If this applies to someone you know, share this with them. I get messages every week from people who keep changing their glasses prescription without ever understanding why. Subscribe to this channel, and every week you get the specific mechanisms and questions to bring to your own physician, so you are never leaving an appointment without knowing what to ask. Coming up next week, why your blood pressure medication may be contributing to falls at night, and what one timing change can do about it. Right now, imagine standing up in the morning and seeing the room clearly on the first look, not after 30 seconds of waiting for your eyes to adjust. I'm Dr. Sarah Kim. I'll see you in the next one.